4th of 2018 in the company of her daughter, period. New paragraph. As you recall, the patient previously underwent a preoperative embolization and open craniotomy on the left side for her Borden 3 dural fistula, period. She returns to us today after having a repeat MRI, MRA for the first time since her procedure, period. New paragraph. From a clinical standpoint, Lori has been doing extremely well, period. She has improved remarkably when compared to the previous notes, period. She is currently ambulating with the assistance of a walker and has a right-sided peripheral vision loss, period. New paragraph. On examination, she indeed does have a right-sided homonymous hemianopia, period. There is no pronator drift, period. She is able to stand and ambulate on her own, but is unsteady, period. New paragraph. The MRI/MRA that was recently done reveals what appears to be a recurrent dural AV fistula on the left side, period. It is unclear from the imaging whether or not this is a Borden 2 or a Borden 3 fistula, period. New paragraph. At this point in time, we spoke at length with Lori and her daughter about our treatment options moving forward, period. Given that she has a recurrent fistula, whether Borden 2 or Borden 3, we do recommend treatment given her age of 55 years old and her remarkable recovery, period. We believe the best option for Lori would be a cerebral angiogram done under a general anesthetic with intention to embolize the dural fistula, period. Again, from the imaging, it's not exactly clear, but this may be a Borden 2 fistula, period. If it is a Borden 3 fistula, it may be possible to attempt a transarterial route, period. Should the fistula be inaccessible, Lori understands that we will not attempt, of course, to treat it, and she will need open surgery at that point, period. We discussed at length all of the risks moving forward for cerebral angiography and for embolization of the dural fistula, period. We'll have her seen in our pre-anesthetic clinic to make sure the anesthesiologist optimizes her before the procedure, period. Thank you so much for involving her in the care of this patient, and we will schedule the procedure as soon as possible. Thank you.
And that went to my doctor?
Yeah, Dr. DiBenedetti.
Good. She's great.
Yes, that went to your doctor.
She's
And you can actually see that whole note on your My chart.
Oh, good.
Yeah, so you don't even need to.